Three, two. Thank you so much for joining me for Understanding Self-Direction in Maine, a training for members, families, case managers, and support brokers. This training is meant to serve as an introduction to the self-directed model. So first, we're going to start with what is self-direction. Then we'll move into the nuts and bolts of self-direction and talk about it a little deeper. And then we'll move into some frequently asked questions that were asked in previous trainings that we thought would be helpful here. Let's start out with the basic of what is self-direction. Self-direction, or otherwise known as consumer direction or participant direction, is really just a model of long-term care delivery that helps people of all ages with all types of disabilities maintain that independence in their home and in their community. In self-direction, the person self-directing decides how, when, and from whom their services and supports will be delivered. Self-direction really prioritizes person's choice, control, and flexibility. To see it another way, you can notice that the person is at the center. In self-direction, the member has choice and control over what services they would like to use, who will deliver those services, how the services will be delivered, and when the services will be delivered. In both traditional and self-directed services, the person is at the center of the services. Both traditional and self-directed services are really taking the member's needs and wants into account. In traditional services, the workers are recruited and hired and report to an agency. However, in self-directed services, the workers are recruited and managed by the person. In traditional services, you can see that everything is happening around the person, while in self-directed services, the member is at the center and controlling everything. So not only in traditional services, not only are the workers recruited and report to the agency, but the program or the agency also sets the tasks, specifies the salary and benefits, specifies the work schedule, decides what training will be required, and then usually the case manager also determines the needs of the actual person. But in self-directed services, as I said, the member is at the center and controlling everything. So not only do they recruit and manage their workers, but they also set the tasks that the workers will be doing. They get to choose the salary, they set the schedule, they train or arrange for training for the worker, and they make decisions about what services and needs are. I always think that it's helpful to see this and hear about this in a real life example. So I've been self-directing for over 20 years. I have caregivers 24/7 in my home. Before I used self-direction, I used a traditional agency, home health agency. I was in college when I used this. When I was in college and using the agency set the schedule. I was going to bed by 9 or 10 p.m., even on the weekends. So I couldn't pull that all-nighter to study for a big test or do that big project. And I was going to bed just as my friends were going out for a wild night. One semester, I even had to get up at 5 a.m. because I had a 7 a.m. class, and that was the only time they could get me up. So I was getting up just as my friends were getting in for a wild night of partying. Now I get to set my own schedule, and I go to bed whenever I am tired. Unfortunately, I'm kind of old now, so I go to bed early anyway. Also, with a traditional agency, I couldn't have care after midnight, so I had to be home in bed and settled before midnight. So I had to leave social gatherings to get home. Now I decide when I'm ready to leave a social gathering and what time I want to go to bed. Also in traditional services, you never get to meet the caregiver before they show up for their first day. There's no training shift or showing them how you would like things until they show up for their first shift. If I didn't mesh well with the worker, I could ask the agency if they would change the person. But unfortunately, if they couldn't change or didn't have anyone else, I still had to have that person that I didn't like doing my care. Imagine that, having someone that you don't like doing really intimate care for you. Also, they probably found out that I didn't like them and it asked to be switched, So imagine having somebody that didn't probably like you very well anymore doing those intimate cares. Now I get to recruit, hire, manage, and interview all of my own workers. I also get to train my own workers so that I can have them do things the way I like. In traditional services, I ate meals on a schedule. I went to the bathroom on a schedule. I showered on scheduled days, and I wasn't able to do it every day. And sometimes I had to choose between eating and showering because I didn't have enough time on my shift. Now I eat when I'm hungry, I go to the bathroom when I need to, and I shower every day, unless I choose otherwise. I hope that helped you understand a little bit more about what self-direction is. Now we're going to go into some hallmarks of self-direction that most every self-direction program has. So all self-direction programs have those choice of goods and services that you want to use in your plan. They also have the freedom to develop the worker schedules, so you can decide when you get up, when you go to bed, when you do things. Self-direction programs are all about getting out into your community and learning about other community resources that are out there. Self-direction also is big on honoring the dignity of risk and understanding that all things in life have risks and weighing that against living a full life. Also, self-direction really values flexibility because you can choose what services you want, but you also get to choose the people you want, and everything is very flexible. You get to be creative in what services you choose and using that flexible spending so you can have individual directed goods and services. And then really in self-direction, it really values that authentic choice and control for participants. There are some common misconceptions of self-direction. One of the misconceptions is that there's a lot of fraud. Honestly, when you put the money in the hands of the people, there is not much fraud because they don't want to do anything to risk their place in the program. Also, there's a misconception of self-direction that it's only for people with lots of natural supports. There are many supports built into self-direction, so it doesn't have to be only for people with natural supports. There's also this misconception that it's only a plan B for when other services aren't successful. It shouldn't be used as a last resort. It should be offered to anyone right away. And also there's this misconception that it's only for people with certain disabilities. For instance, maybe it wouldn't be appropriate for people with intellectual or developmental disabilities. Not only am I a participant who uses self-direction, but I was a support broker and am a support broker for many years. And I've seen many people with many different types of disabilities be very successful in self-direction. Now you're probably asking what services can be self-directed. So the following services can be self-directed in Maine. We have home support. We have community support. We have that financial management services. We're going to talk a little bit more about what they are in a minute. We also have support brokerage, which we're also going to talk about a little more in a minute. We have individual directed goods and services. I know I sound like a broken record, but we're going to talk about that a little bit more in a minute too. And then we have assistive technology, devices, and transmission. So for example, if you have a personal emergency response system, not only would the self-directed portion pay for the device, but they would also pay for the transmission or the use of it every month, the service fee for it. And then we also have home accessibility adaptions and home accessibility repairs and replacement. So you can get that home accessibility adaption, maybe a ramp or something like that. But then if something happens to it, you can also get it repaired or replaced. To tell you a little bit more about individual directed goods and services, we're going to talk about that right now. And so some of the requirements are that it has to be approved by the state before it can be purchased. The individual directed good or service must meet a need previously specified on the person-centered plan. So it has to be something that was already on the person-centered plan that needs to be purchased. It must help the member be able to do either more for themselves, be safer at home, and or get out into the community more. And it cannot be funded from other places such as Maine Care or something like that. There is really no pre-approved list of things you can buy because Maine really wants you to be creative and find those cool things that you would like to do. So they felt like if they gave you a pre-approved list, that would really squelch your creativity. So really think about what's on your person-centered plan and what kind of things would make that more accessible for you. If you would like to cook and maybe you want to take a cooking class and then need some adaptive tools to help you cook, that might be something. Again, it's only something for you. So just because your friend got it doesn't mean you will also get it. Some things that are not allowed, though, are giving money to or buying things for anyone, including friends, family, or self. You cannot buy food or drinks, including meal replacement drinks. You cannot buy drugs or alcohol, and it cannot be used towards your rent or house payment or utility payments. Now we're going to get into a little deeper the nuts and bolts of self-direction. The Maine self-direction programs have two authorities. And the word authorities just means things that people in the program are able to do. So with this program in Maine, you have employer authority, which means that you get to recruit, hire, and manage your own workers. You get to set that schedule for the workers. You get to provide training for workers or decide what other training you want. Obviously, you still have to make sure that your workers do the agency training or the state specific training. But you also can decide what other training you want them to have. If you want to just provide that training right there in the home so they know what they're doing, that's great. You also have to discipline and or terminate any workers, which is the not so fun part. But in addition to employer authority, in Maine, you also have this really cool thing called budget authority. So each person in Maine has an individual budget. With that individual budget, you get to set the hourly range for the workers, obviously within state minimums and maximums. You get to determine the workers' training requirements beyond any state requirements that are there. You get to decide how much of the budget is used for each service and how much you want to put towards each thing. And you can also purchase those individualized goods and services. So now we're going to talk a little bit about the different components of self-direction. All these components work together to make sure that you're all successful in self-direction. So the first component is you, the person self-directing, or the member. The member is the number one priority. You are the ultimate decision maker. The member manages and directs the services and supports. They understand and accept the responsibilities of the program. You're going to work with your case manager to create that person-centered plan. They will then help you decide what services and supports will meet those goals on that person-centered plan. You're also going to make sure you're following that spending plan so you're not overspending or using too much of your money. And then you're going to purchase goods and services that are in line with those needs on the person-centered plan, like I said. If you decide you really think self-direction is cool, but it sounds like maybe just a little bit overwhelming and you can use some support, then you could add in a representative. A representative could be your guardian if you have one of those, a power of attorney if you have one of those, or just a trusted family member or friend who's going to help you with those tasks. Because sometimes it can be a little bit scary and overwhelming. But don't let that count it out for you. Because you really can make a difference in your life with self-direction. So the one thing is that a worker cannot also be a representative. So keep that in mind. If your friend or family member is your worker, they can't be your representative. What does a representative do? Well, they really just help you with all of your self-direction responsibilities. All those things that we named in the last one, including managing workers and hiring workers, attending meetings with you. They manage all or some of your employer tasks on behalf of you if you would like them to. And they'll also receive and review those copies of the notices from your FMS provider so that they can help you read through them and figure out what you need to do. Now, workers in self-direction are the people that are recruited, hired, and managed by you or your representative. The workers are the ones who provide that hands-on care, support, and help you get out into the community. Again, they can be your friends or family, including your spouse. They cannot, again, be your representative, though. Workers must be at least 17 years old, and workers really need to embrace that self-direction model and understand that it's your choice and you are in control. The workers complete all required trainings and paperwork, and they really understand that you are the employer, not the support broker or the case manager or the FMS provider, no one but you. Now we're going to move on to the second component of self-direction, which is commonly called information and assistance, which is just a fancy term for the people who help you do the actual act of self-directing. So the first person who would be considered an information and assistance provider for you is your case manager. This is your first point of contact to discuss self-direction with a member. This is a person who you've either probably already talked to about self-direction, or after this video, if you want to get into self-direction, that's who you would talk to. So the case manager is going to talk to you about all the program guidelines and responsibilities. They're going to help you develop that person-centered plan and then modify it as you need to. They're going to help you choose and refer you to FMS providers and support brokers. They're going to help monitor your goals, your service implementation plans. They're going to communicate with you, the support broker, and the FMS provider to make sure everyone's on the same page. And they're going to also help continue manage and answer questions for those traditional services that the provider managed services that you didn't decide to self-direct. In addition to a case manager, you also have a support broker on your side to help you. They are different from a case manager because they really provide that hands-on skills training to you. So if you need help, maybe hiring a new worker, finding places to put ads, things like that, that's where the support broker would come in. They're also going to give you resources and guidance in all aspects related to self-direction. They're going to help you complete and revise your spending plan and your service implementation plan. They're going to really help with problem solving when those things come up. Maybe you're having a hard time with one of your employees or something like that. They're going to help you talk through it and figure out what the best solution is. They're never going to make decisions for you by any means. They're just going to help you come up with some different solutions and see which one you think is best. They're going to help you track that spending again to ensure there's no overspending. And they're going to help you get those self-directed services to make sure you're meeting your health and your needs are being met. They're also usually generally very knowledgeable about community resources, so they can help you figure out other places you could get some support. And then that final component of self-direction that makes everything come together and run smoothly is the financial management services entity. The financial management services provider does all the reporting, regulations, and financial responsibilities of self-directing. That includes the fiscal, reporting, budget, and employment responsibilities. So the financial management services provider enrolls you or the member and explains all the enrollment paperwork. They also process all the paperwork for hiring workers. They complete financial transactions only based on your spending plan. So if it's not on the spending plan, they won't pay it. They also file and deposit all employee taxes and labor payments and forms. And then they also track and communicate about your spending or your payments with you and anyone else on your team, maybe your support broker or your representative. So they take care of all that financial stuff. All of these people work together to make sure that you are very successful in self-direction. Now we're going to move on to some frequently asked questions that have been asked by many members, support brokers, and people in the program. And we thought it'd be helpful to have it right here in this video. The one thing is, how is my budget determined? So basically, you will decide what flexible budget services you would like to self-direct. The flexible budget services include your home support and your community support. Once you decide how much of those services you would like and how many hours, the amount of that services will be cashed out. Now, by saying cashed out, I don't mean that you're going to get cash in your hand. It means that the amount is put into a budget for the member to use. So the amount that you would have spent on those services and traditional services is put into a personalized budget for you to use. Then the support broker payment is taken out of that budget. For any person in this program, the maximum support broker hours are 50 hours per year at $68 per hour. Support brokers can also be scheduled in 15-minute increments. So if you don't need a whole hour, you could do a 15-minute video chat, 15-minute phone call, or a 30-minute meeting. And then the FMS fee is also taken out of the budget. And the fee for FMS providers is $125 per member per month. Another question that's come up is how many FMS entities are there in the state? Right now, there are 2 FMS entities to choose from, GT and Pelco. And how do I find a support broker then? If you're using Pelco as your FMS, you will need to work with an independent support broker. You can find a whole list of independent support brokers on the ODES provider directory. The link is provided here. However, if you're using GT independence of your FMS provider, you can choose to have one of their support brokers, or again, use an independent support broker. Your case manager can refer you to support brokers and FMS providers. And then some people have raised some concerns over self-direction. They want to know how members are protected from abuse and neglect or being taken advantage of. As we just went through, there are many supports in place to ensure that this isn't happening. There's a case manager and there's a support broker. Traditional services don't have a support broker there providing that more hands-on help. There's really no greater chance of this happening in self-direction than in provider-directed services. In fact, there's less of a chance because the support broker is also around. Also, because people are able to choose people who love them and know them already, there is less of a chance. There's that question, is fraud higher in self-direction? No. And in fact, the data shows that fraud is actually very low in self-direction. In many cases that are considered fraud are actually just people making a mistake and not realizing program rules. As I said earlier, the member doesn't want to do anything to jeopardize their support. And finally, in wrapping up, we just want to remind you the benefits of self-direction. Self-direction is incredibly empowering to members because members get to be in control of their own supports and services. There is much less unmet need in self-direction because people can hire friends and family and tap into that worker pool of people who maybe wouldn't work in caregiving in an agency, but they would work for their friend or family or neighbor that they already know. Because people are hiring friends or family or people they know and like, or people that they at least got to choose, there is a lot less turnover in self-direction. As we've talked about many times, there's so much more control and choice in how services are delivered. Self-direction is much more flexible and people can use the money for what they need. As we talked about, we have those individual directed goods and services. People can be creative with what they would like to purchase. As we also talked about, it allows for dignity of risk. We have those built-in supports, the case manager, the support broker, and the FMS. Participants and members in self-direction can train their workers on how to do things, how they want things done, not how an agency says it should be done. And a lot of parts of Maine are very rural, and self-direction can be especially helpful there because you can hire that neighbor or that grocery store clerk or somebody like that. With all good things, there are also some challenges of self-direction. In self-direction, you are in charge of all staffing, which means you have to recruit, hire, and manage all of the workers, including having to have those difficult conversations with workers when things aren't going that well. And sometimes, as I said, you even have to do disciplinary actions and/or terminate someone, and that's never fun. You also have to find fill-in workers when people call in. Sometimes we're just not trained to be employers. We don't know employment law and things like that. That's where our support brokers come in and can be really helpful. Also, people don't always respect us as the boss or the employer. Again, that's when we have to be our own advocates and when our support broker could really help. Sometimes those program regulations and responsibilities can be really challenging and hard to understand. So that's when we're going to talk to our case manager and our support broker and make sure they put it in language we can understand. Also, some of those program documents that have to be filled out can be kind of hard and a little bit hard to understand. But that's also when we have our support broker and our case manager to help us. Also, it can be kind of challenging to trust those people that we barely know with our personal cares and our information, because we've now just hired an employee and we have to have them help us do really intimate cares. But it's always an opportunity to make a new friend, is what I always think. And sometimes, unfortunately, gatekeeping happens, where the case manager doesn't think that someone is appropriate or right for self-direction, so they don't even offer it. But that's not fair, because everyone should be offered self-direction. As I talked about, there are those challenges for employers to do self-direction, but there are so many tools to help employers. To help you be a better employer, there's the Employer Handbook for Self-Direction in Maine. There's the mini handbooks for self-directing employers. If you don't want to read the big long one, you can read the shortened version. Or if you don't want to read it at all, you can watch the video series starring me. If you need tools to help you with budgeting and planning, you can go on the website and there's the individual directed goods and services request form, the spending plan tool and spending plan instructions, and there's also the video training module on the individual directed goods and services. So you can get a little more in-depth information on it. Where can you find all these resources that I've been talking about? You can go to visit www.maine.gov and search self-direction. And finally, let's talk about some truths about self-direction. Self-direction is really for everyone with the right supports. It really increases choice and control for everyone, and it really reduces unmet needs. And as we've talked about, there is no more fraud than in traditional services. Self-direction is truly a life-changing experience. Thank you so much for listening.